15 things that can make tinnitus worse. Tinnitus is the perception of noise or ringing in the ears. It is a common problem, affecting around 1,520 of the world's population. Tinnitus itself is not a disease, but rather a symptom of an underlying condition such as age-related hearing loss, ear injury, or circulatory disorders. In addition, loud noises. Noise is one of the most obvious factors that can make tinnitus worse. Loud sounds from machinery, headphones, concerts can cause temporary ringing in the ears or even permanent hearing loss. To protect your ears from noise, move further away from the source of loud noise. Wear earplugs or noise-canceling headphones. Turn down the volume when listening to music or watching movies. Protect your children's ears from loud noise. 2 medications that can cause tinnitus. Certain medications can cause tinnitus as a side effect, including antibiotics such as aminoglycosides, gentamicin, streptomycin. Diuretics such as furosemide, hydrochlorothiazide. Antidepressants such as amitriptyline, floxetine. 2 medications that can cause tinnitus. Nonsteroidal anti-inflammatory drugs NSAIDs such as ibuprofen, naproxen. Cancer drugs such as cisplatin, carboplatin. If you are taking medication and notice tinnitus, talk to your doctor about changing your treatment or reducing your dosage. 3. Stress and anxiety. Stress and anxiety can make tinnitus worse. When you are stressed, your body releases the hormone cortisol, which can affect hearing and cause tinnitus. To manage stress and anxiety, practice relaxation techniques such as meditation, yoga, or light exercise. Talk to a therapist about stress management techniques. Limit exposure to people or situations that cause stress. 4. Lack of sleep. Lack of sleep can affect your overall health and make tinnitus worse. When you don't get enough sleep, your brain is unable to fully recover and may be more susceptible to noises around you. 5. Dehydration. Dehydration can lead to tinnitus because it affects blood flow to the inner ear. 6. Caffeine. Caffeine can increase blood pressure and stimulate the body, which can make tinnitus worse. 7. Alcohol and tobacco. Alcohol and tobacco can damage blood vessels and reduce blood flow to the inner ear, which can exacerbate tinnitus. 8. Exposure to dust and smoke. Exposure to dust, toxic chemicals, and polluted environments can damage the inner ear and increase the risk of tinnitus. 9. Medical conditions. Several medical conditions can cause tinnitus, including cardiovascular disease such as high blood pressure, atherosclerosis. Thyroid disease such as hyperthyroidism, hypothyroidism. Metabolic disorders such as diabetes. Autoimmune diseases such as lupus, rheumatoid arthritis. 10. Ear injuries. Ear injuries from accidents, loud noises, or other traumas can damage the inner ear and lead to tinnitus. 11. Age. Tinnitus is a common symptom in older adults due to age-related hearing loss. 12. Middle ear infections. Middle ear infections can cause tinnitus, especially in children. 13. Hormonal imbalances. Hormonal imbalances, particularly in estrogen, can affect hearing and lead to tinnitus. 14. Low blood pressure. Sudden drops in blood pressure can cause tinnitus. 15. Weather changes. Some people find that their tinnitus gets worse with changes in weather, particularly when there are changes in barometric pressure. Note: if you have tinnitus, it is important to see a doctor for a diagnosis and treatment. In addition to avoiding factors that worsen tinnitus, you can also take steps to reduce your symptoms, such as using white noise machines or natural sounds to mask the tinnitus. Note: joining support groups for people with tinnitus to share experiences and receive support from others. Practicing stress management techniques. Maintaining a healthy diet and lifestyle. Please note this article is for informational purposes only and does not replace professional medical advice. If you have tinnitus, please see a doctor for a diagnosis and treatment.